Hi, my name is Lance Reedy, and I'm a member of the National Association of Medicare Supplement Advisors. I live in north central Idaho, and I represent millions of people across America who have Medicare supplements, people that depend on their agents to guide them through the confusing Medicare maze. The purpose of this video is to express our opposition to Senate Bill S-1416 Kerry and H.R. 2645-Stark, also known as the Kerry-Stark Bills. We have published a booklet explaining our case and the value of our work, and we have distributed it to each U.S. Senator and members of the House of Representatives. We're on the forefront of explaining the various components of the Medicare programs to Medicare beneficiaries. The vast majority of them are simply confused and overwhelmed by the entire process. Some brief history is in order. Congress passed the Omnibus Budget Reconciliation Act of 1990. Senator Max Baucus of Montana introduced legislation which set minimum loss ratios for companies selling Medigap policies or Medicare supplements. They were to return 65% of collected premium back to their policyholders in the form of claims. This Baucus amendment streamlined the Medicare supplement business. The plans were standardized, agent commissions were reduced and paid out over a period of several years, and the minimum 65% loss ratio was established. The Medicare supplement business has now operated almost flawlessly for over 20 years. Our members feel that a reduction in Medicare supplement compensation, which would be the result of this new legislation, would limit producers in their efforts to provide valuable services. Services which Medicare beneficiaries have come to depend on. Let's look at some background. On July 26, 2011, Senator John Kerry, Massachusetts, and Representative Pete Stark, California, introduced into the Senate and House, respectively, bills entitled Medigap Medical Loss Ratio Improvement Act of 2011. The intent of these bills is to raise the loss ratios of the 1990 Baucus Amendment from 75% to 85% for group sales and from 65% to 80% for individual sales of Medicare supplement policies that will be sold after January 1st, 2014. We are adamantly opposed to this legislation and ask your support by requesting your congressional delegation to oppose the Kerry-Stark bill. Here are some key points. In the rush to eliminate or cut agent compensation, which these bills would do, medical loss ratio requirements have been perceived as returning more money to the public. We have an argument with that assumption. The assumption is that increasing company loss ratios by decreasing administrative cost is a good thing for Medicare beneficiaries. This is just another way of saying cut producer compensation or cut them out of the process altogether. Does the public want a reduction of service and personalized help? I don't think so. We are hard-pressed to find anybody who can understand the web of Medicare, Medicare supplements, Medicare Advantage, and Part D prescriptions without the aid and assistance of an agent. We believe that even members of Congress would find difficulty in sorting out the benefits of their own policies. In his public announcement, Senator Kerry referred to the bill as an example of patient protection. We can find no such indication of patient protection, but it appears that legislators at any level, county, state, or federal, can invoke patient protection as a trendy phrase to appeal to the public. These bills offer no such indication of patient protection as was genuinely achieved by the 1990 Baucus Amendment. To the contrary, the passage of these bills will lead to more patient confusion. Nor can we find any indication of improvement as the titles of these bills imply. Do we improve the modern passenger car by reducing or eliminating safety features in order to lower costs? We know the value of the service we give to our clients. Few people can explain the benefits of their own policies, let alone understand the underlying benefits of Medicare. As producers, that is our job, and one which we value highly. Nothing will improve by diminishing agent service. Although the sponsors think that their legislation will reduce premiums for Medicare supplement policies, it will likely do just the opposite. If insurance agents were not available, the cost to insurance companies would increase. They would need more customer service reps to answer various questions from their clients. Agents spend a good deal of their day answering these questions while working with the personnel at the insurance companies to resolve miscellaneous problems. This is teamwork, and without it, the clients would be sitting on hold waiting for the next available rep to help them. There are no real savings in the Kerry-Stark proposals to be passed down to the policyholders. Sending clients to Medicare or Medicare.gov is not the answer. If these bills were to pass and agents were to disappear or be diminished in their ability to serve, clients and prospective Medicare beneficiaries would be forced to call 1-800-MEDICARE for answers. Medicare would then have to hire hundreds or even thousands of new call center representatives and take up to an hour or more explaining the Medicare maze. This function is now performed by Medicare supplement producers at no charge to the government. In short, there are no savings for an already stressed Medicare program, and in fact, these proposed bills would likely increase costs for Medicare. For sure, there would be unintended consequences, which in all likelihood would be detrimental in the long run for Medicare beneficiaries. There is nothing to be gained for anybody by upsetting the current Medicare program and specifically Medicare supplement policies. In view of the fact that medical loss ratios already exist via the Baucus Amendment, we feel that the request of a few people to increase those ratios are neither in the best interest of Medicare, the Medicare buying public, or America as a whole. Our clients are not unhappy with our current services, our policy choices, and availability as they exist. And above all, they are not calling for any changes in the Medicare product offerings. Here are just 3 comments from agents. There are 2 constants that exist when I walk into folks' homes. First, there is a pile of brochures from insurance companies that they don't read or even understand. Second, there is a need for professional and honest assistance to help them make the best decisions because they simply don't understand the obscene complexities of Medicare. If Medicare is fooled with, and I can't make a living due to commission cuts, many people needing help won't receive it. They might be forced to sign up online or over the phone with a disinterested call center representative. And in many cases, they will end up paying yet higher premiums. What I find as I speak to Medicare recipients is this: they are so totally confused about the various Medicare insurance choices. Their educational or economic status does not matter. Throw in Medicare Advantage and Part D prescriptions, and you just as well might be talking a foreign language. They need help in understanding their options and the ramifications of their decisions. I see myself more and more as an educator and not as a salesman. I helped Mrs. Jones save over $2,800 on a prescription plan last fall during the annual election period. As an agent, I give personal testimony that the above comments are so true. The following are just a sampling of letters that we have received from our clients. This Medicare and You guide is so confusing, and I've received a ton of material from so many different insurance companies. That's why I decided to call an independent agent to explain this guide and how the information can help me. I wish to take this opportunity to express my appreciation for your efficiency and courtesy throughout this entire process of choosing an insurance provider in addition to my Medicare. My questions were answered in a timely manner. Your attention to detail as well as your patience helped with my decision making. Again, thank you. Thank you so much for all the kind and courteous service you have provided to my wife and me over the years. It is so comforting to know that we always have someone who understands the endless tape of Social Security and Medicare and will watch over our needs, saving us hours of research and study. We never hesitate to pick up the phone and call you, just like an old friend. As verified by testimony from agents and clients, our clients would be hurt by passage of the Kerry-Stark legislation. The current commission schedule is adequate for us to pay the overhead to run our business and to be available to provide service for our clients. To disrupt this relationship would be harmful to the 9.3 million Americans who count on us. There's an old axiom: if it ain't broke, don't fix it. The Medicare supplement system has been working well since 1990. Most policyholders are happy with their policies and their agents. The 20-plus-year-old compensation schedule is working just fine. That is what allows agents to be available 7 days a week to troubleshoot problems. In conclusion, please contact your congressional delegation and urge them to vote no on the Kerry-Stark legislation. Thank you for watching.